This is CBC Here and Now.
Welcome to Here and Now. I'm Carolyn Stokes.
And I'm Anthony Germain, working from home. I'm in self-isolation where I'll be for another week. Here and Now is going to be a local 30-minute newscast for the entirety of the COVID-19 crisis.
And we'll be bringing you the latest information on how the virus is affecting life in this province. Now, let's get to the latest. A big jump in the number of presumptive COVID-19 cases in the province today. The virus is now in all health regions, and we heard a stern message from the Premier today. Let's start with Here and Now's Peter Cowan, who's live in our newsroom. So, Peter, what can you tell us about these new cases announced today?
Carolyn, the surprising thing is most of the cases we're seeing right now are in the eastern region, and most of them are all tied to one place in St. John's. The cluster at Call's Funeral Home is now responsible for 2/3 of the total cases that we've seen so far. Let's take a look at a few of the numbers here. So the Chief Medical Officer of Health announced 32 new presumptive COVID-19 cases this afternoon. And the first case for the West Coast. That one is believed to be travel-related, but health officials are continuing to investigate. The other 31 new cases are in the eastern region. Now, there are a total of 67 cases in the province, and of those, 44 are believed to be connected to Call's Funeral Home. Who's being affected? Well, Dr. Janice Fitzgerald says the ages of those with COVID-19 are ranging from 8 all the way up to 78. Now, one of the questions a lot of people are asking is, did someone break the rules in order to attend the funeral? And so far, Dr. Fitzgerald says they don't believe that anyone was violating the orders that were in place back on March 15th, 16th, and 17th when this exposure occurred. But it does show just how quickly this virus can spread from just one person. And today, the Premier had a very stern message for those who are still not following the rules.
For those of you who are supposed to be in self-isolation, some of you are simply just not taking this seriously. One of the consequences, or some of the consequences that we put in place, would be fines. So in addition to fines, we are immediately taking away your driver's license. We will explore every opportunity that we have to put those measures in place on the current legislation that we have. So taking away your driver's license is another one of the consequences, in addition to the fines.
Of the 61 cases in Eastern Health Region, at least 44 are associated with Call's Funeral Home in St. John's. 8 other cases are travel-related, and the remainder are under investigation. I want to speak now to those who attended the Call's Funeral Home in St. John's on March 15th, 16th, and 17th. Based on Eastern Health's public health investigation, I am ordering you to stay at home and self-isolate until April 1st.
Gerald there with a message to anyone who was at the funeral home. And driving home, we heard the Premier just how serious this is. The RNC has had to respond to one case in Corner Brook. They arrested a 53-year-old woman after she refused to comply with the regulations. Carolyn?
Thanks, Peter. Well, some patients at Eastern Health have been sent home to self-isolate because they came in contact with healthcare workers who tested positive for COVID-19. So let's bring in Anthony now. Anthony, what more do we know about this?
Well, that's one of the remarkable parts of the story as it develops today with those numbers Peter Cowan just gave us, the fact that some people, as you just mentioned, Carolyn, came into contact with healthcare workers. This raises a certain number of issues, and both the health minister and the Premier wanted to clarify part of this story today.
The staff that may have come into contact with these individuals have all been sent home to self-isolate pending contact tracing, and there were patients who were able to go home and have gone home to self-isolate with the usual follow-up from public health. So that unit is currently being cleaned, and once clean will be available again for patient care.
Since there's no patients in hospital right now, this is not something that the healthcare worker would have acquired working with a patient in the hospital setting. So they would have been, I guess, normal citizens doing the things that they do. Whether it was at Carl's funeral home or not, I guess we're not sure about that.
Okay, so Anthony, this news comes just as the nurses union is asking government for more leeway for nurses to decide how best to protect themselves.
Well, it's interesting because now we've got two issues here that have to do with nurses and healthcare professionals. In this case, they did not get into contact with anybody inside the hospital. What the nurses are concerned about is what if they do. And so that's why they reached out to John Hagee again today, asking for some kind of recognition that nurses should have the right, if they don't feel that every precaution has been taken, to say, you know what, I am not going to treat this patient. And what's brought us here, Carolyn, take a look at some of the numbers. In Europe, you've got 30 healthcare workers have died, and you have thousands now who've tested positive who are staying home in self-isolation. So if you end up in a situation where nurses and healthcare workers have to stay away from the healthcare system, that will create its own problems, not to mention the fact that you'll have a lot of people who are upset about the fact that they've become infected or tested positive. So the issue here is whether or not nurses should be recognized to have this right. And there's also, as Debbie Ford with the nurses union pointed out, some issues about equipment as well.
And essentially what we're saying to government is, let's use the expertise and knowledge and the point of care assessment of the registered nurse or other healthcare provider who is in the healthcare environment in the situation. Let them do their assessment of the patient that they're having to care for or do a test on. And based on their very wise and knowledgeable assessment, let them choose the appropriate mask that they should wear in that situation.
Now, one issue about masks, Carolyn, is with this N95 mask. I managed to pick up a box of these when I was in Toronto, which is why I'm in self-isolation. But the nurses have had a bit of an issue with the health department wanting to have specially fitted masks, this kind of mask used, and apparently there's a shortage of them. This is an issue that they put on the agenda a while ago, and they're still waiting to get some sort of information back as to why there aren't enough of these masks. So that is one of the issues as this story continues to unfold. Carolyn?
Thanks, Anthony. Well, the Premier also announced new childcare services for essential workers who must be on the job during this crisis. The president of the province's largest union says that's a positive move not only for union members, but all frontline essential workers.
That takes that concern away. Who's going to look after my child if I'm required to work? Because some people just cannot work from home, cannot be relieved of their duties, and are on the front lines of this.
And it's no walk in the park in St. John's right now. The city closed the parks yesterday. It's part of the additional restrictions related to the COVID-19 crisis. The city says all public parks, ball fields, and dog parks have been closed to help prevent people from gathering in groups. The city closed playgrounds last weekend. And we also heard from Parks Canada. They're asking people to stay away from historic sites like Signal Hill as well. Well, Service NL has stopped work at Memorial University's core science building. As Ariana Kelland reports, the order comes after workers raised concerns about COVID-19 precautions.
A spokesperson from Service NL says health and safety officers went to MUN's new science building this week. There were concerns over the number of people working on the site. As of yesterday, the province is limiting gatherings of 10 or less. There are hundreds working on the university's new building. Officers were looking to see if workers could practice safe social distancing and stay 6 feet apart as directed. As a result, the contractor, Marco, was given a stop work order until the employer provides a site response plan. Multiple workers have reached out to CBC News with concerns for their own health and safety. They say construction of the science building should not be deemed essential work, despite construction being listed as an essential service by the provincial government. Construction falls under repair services with electrical, plumbing, appliances, and heating. Marco CEO Christopher Hickman says his company has been working with health and safety. He says they take the safety of workers and the community seriously and are following the government-issued guidelines. Hickman expects the order to be lifted today. Ariana Kelland, CBC News, St. John's.
And one of the companies bringing food and cargo to Newfoundland says that supply chain has not been interrupted. Many shoppers are worried that goods wouldn't make it here, and some began to panic shop. OceanX says this is how 75% of food and medical supplies gets to Newfoundland. So far, the company says it's been business as usual, with container ships arriving and departing on time. The company says there's also room to carry more cargo if necessary. However, OceanX has taken steps to ensure its staff is safe.
There's no shortage of product at the moment. To this point in time, it's fairly normal. I think where that stems from is people headed to the stores thinking there would be a problem, and they basically cleaned the store out. And the stores are now been refilled.
An Italian exchange student has left Newfoundland and returned home to Milan, the epicenter of the Italian coronavirus outbreak. Eduardo Spinoza didn't want to leave St. John's, but the company told exchange students they had to return home.
Now that I have to leave Newfoundland and St. John's, the city that housed me for the last 8 months, I'm pretty sad and worried, because I have to go in a country, in a place where coronavirus is making a lot of people sick. That's not really my choice, but I can understand that maybe it's the best choice for me, for my future. Of Newfoundland, I will miss a lot of the people, because all people here in Newfoundland are very kind. I really love this country and all the people that I meet and I know here. For the rest, I want to say to Canada, dear Canada, you host me for the last 8 months in my life. Thank you so much. I will fall in love for you, Canada. Please, Canada, don't underestimate this problem. Don't underestimate coronavirus. Take Italy like example, and please be careful.
We saw quite a bit of snow through areas of central, eastern areas saw lots of snow as well. We've got some rain to melt all of that away as we head into Friday. We'll have all those details coming up.
The Red Cross in Atlantic Canada is operating a helpline to provide assistance during the COVID-19 outbreak. The idea is to relieve some of the pressure facing Newfoundland and Labrador's 811 helpline system. Rhonda Kenny is with the Canadian Red Cross and she's in Paradise, joins us now. So Rhonda, can you tell us how this helpline works?
Hi, Carolyn. Yes, Red Cross is really pleased to partner with the province of Newfoundland to provide this Red Cross helpline. So basically, it's a line for information, for referrals, and inquiries. So individuals who do, and it's non-medical, non-emergency, and just really want to make this clear. So when an individual calls the Red Cross helpline, our callers answer the questions. There's a lot of the information actually that's currently on government websites. However, one of the nice features of the call center is that they're able to speak to an agent face to face to answer those questions, such as like, how do I know if I have to self-isolate? What are the time requirements of that? And then when there's an individual who outlines a very specific need, then what they're referred to is our virtual operations team, our virtual operations center. So certainly over the last number of years, the Canadian Red Cross has really increased their capacity to be able to support individuals through technology. So an individual speaks to one of the members of our virtual operations team. They go through an assessment process, a registration process, and then the need has been identified and then referred out to, certain support systems within the community. So we're able to, facilitate that inquiry and request from the client.
Okay, so someone who is wondering, should I go get tested? Are my symptoms something that's worthy of getting testing? They can either call 811 or they can call the Red Cross line and get that answer.
Yeah, and so certainly the establishment of the Red Cross helpline is to alleviate the pressure that's currently, being placed on 811 and 911. So I really want to emphasize that point as well.
And are you getting a lot of calls?
Absolutely. So since the launch of the number, which was kind of late afternoon on Sunday, we've seen like an escalation in the number of calls we've received, double on Monday, tripled yesterday, and activity is quite busy today.
All right. Well, Rhonda Kenny, thank you so much for telling us about this and for giving the folks in the province another option, another phone number to call to answer their questions.
That's right. Thank you, Carolyn.
Thanks. And in case you missed it, here's the number once again, 1-800-863-6582. The Red Cross support line is open daily from 8 a.m. to 8 p.m. All right, so let's bring in Ashley, who's working from home today. It's good to see you.
Yes, nice to see you.
Well, I think a lot of people would agree that the last thing we need right now is more snow, but at least it meant that it was a good day to stay indoors.
Yeah, the sunshine, when the sun's not there, it makes it a little less nice to go outside, that's for sure. But yes, we did see lots of snow overnight and through parts of the day today, a little more than expected through central. That area of low pressure tracked a little bit further west. Here's where we were sitting number-wise. 18 centimeters of snow was recorded in St. John's, 23 in Gander. Then Gander West saw 29 centimeters. So we did see certainly that snow shift a little bit further west. Terra Nova saw 27, and then Stephenville looking at about 5 centimeters of snow today. Now, the area of low pressure has moved offshore now. We're seeing clearing skies in behind that as a ridge of high pressure dominates. And we should start to see some clearing skies as we head into the evening and overnight hours as that low continues to pull the snow right along with it. And then in behind it, we do have that area of low pressure starting to get organized. That's what's going to head our way and bring some warm temperatures too as we head through the day on Friday. So overnight tonight, not a whole lot going on. Our temperatures will dip overnight into the minus single digits, minus double digits in some areas along the coast and even through parts of central as well. We'll probably see some cooler temperatures into the minus teens. And then as we head through the day tomorrow, not a whole lot happening because we're still under that ridge of high pressure, but we will start to see some increasing cloud. Some flurries and light snow will develop for Lab West, even areas of northern Labrador as well. And then note that system that's on its way Overnight Thursday, we'll start to see some snow, heavy at times along the south coast, and that's going to change into some rain as we head into Friday. So here's where we'll be sitting tomorrow afternoon, somewhere between 0 and as much as 5 degrees for areas along the west coast. The winds will finally die down for the east. We'll switch from northerlies to easterlies, and we're looking at about 20 to 40 kilometers per hour. Up through Labrador, a beautiful afternoon for the south. Southeast and central, 5 degrees for Happy Valley, Goose Bay. Again, that potential for some snow for Lab City, and then flurries later on in the day for Nain. Your winds will be gusting somewhere between 30 to as much as 50 kilometers per hour. So we're done with that system that just rolled through, but the next one, like I said, is already prompting a special weather statement and then a wind warning down for the Rec House area. You're looking at gusts tomorrow night into Friday morning, upwards of 120 kilometers per hour. And if we take a look at the timeline, there's that snow quickly transitioning through to either ice pellets or freezing rain to heavy rain by Friday morning for areas along the south. Northern Peninsula, you're looking at pretty heavy snow continuing through much of the day, and then eventually we'll see things change over to rain. And then coastal Labrador into the evening on Friday is when you'll see your transition to rain. So here's where we'll be sitting temperature-wise, 3 to as much as 8 degrees, which is why we're going to see that transition to rain. Again, more than likely going to see rainfall warnings along the south coast, potentially even some wind warnings extending from that Rec House wind warning. And then as we head into Saturday even, up through northern portions of, or at least coastal areas of Labrador, the wind and the snow will stick around. So we'll anticipate probably some either advisories or some warnings for you. So just before I leave you tonight, just wanted to share this beautiful weather photo, spring evening in Port Saunders. Thank you so much for sharing that photo with us. And if you have any weather photos you'd like to share with us, send them to nlphotos@cbc.ca.
Beautiful. Thank you so much, Ashley.
Of course.
So let's recap the top news of the day today. The number of positive cases of COVID-19 in this province now sits at 67, a jump of 32 cases announced today. Now, 44 of those are all tied to Call's Funeral Home in St. John's. That means anyone who visited that funeral home between March 15th and 17th are required to self-isolate. Now, some healthcare workers at Eastern Health have also tested positive for COVID-19. They're at home in self-isolation, and any staff or patients who were in contact with them have also been sent home to self-isolate.
This virus for most people presents with mild symptoms. The days of going to work with the sniffles are over. If you are sick, you need to stay home. This is for everyone's health and safety.
For those that are watching right now, I want to be very clear. If you're not following the critical guidelines that we put in place, we will not hesitate to take further action. Be responsible and do not for 1 second think about jeopardizing the life of others.
The safe thing for you to do now is assume that there is COVID around you and to stay home and stay apart, but stay connected.
Some good advice there, Anthony, and we're expecting another briefing from health officials tomorrow.
Yeah, certainly this is a historic, strange time, Karen. I was thinking today, even doing my driveway, there's so much snow, any schools cancel, but there's no schools to cancel. And you just think about doing a show from our house, which I've never done in 28 years. But tomorrow, a very historic day as well, as these things keep changing. The House of Assembly is going to meet. They'll be talking about some budgetary measures. But what's history-making is that you only have a total of 10 MHAs. You go back 100 years to the Spanish influenza and the First World War. The House of Assembly has never done this before, to my understanding. Maybe someone will correct me, but a very, very big, important day tomorrow, not just for that history moment, but obviously some very important decisions to make as COVID-19, not just a health concern, but obviously an economic one as well.
Yeah, incredible times for sure. Thanks, Anthony. And something else worth noting before we leave you, we have an update from Canada Post, and there will be no mail service in the St. John's and Mount Pearl area for the remainder of the week. The Canada Post facility shut down on Monday after a worker tested positive. It was supposed to reopen tomorrow, but will instead remain closed for safety reasons. Anthony, we'll talk to you tomorrow. And you know, even during this crisis, there are some moments where things just feel normal, like digging out after a snowstorm like Anthony did earlier today. It was a messy start to the day for many people. It likely would have been a snow day, or at least a delayed start for school if things hadn't already been shut down because of the COVID-19 restrictions. Well, that wraps up this 30-minute edition of Here and Now tonight. Please stay tuned. Your latest COVID-19 headlines for the rest of Atlantic Canada are coming up next.